Hello, this is Dr. Swapna Priya, consultant dermatologist, cosmetologist, trichologist from Care Hospitals, Banjarals. Today I would like to discuss about the treatment of the birthmarks which a patient has multiple times on their face or even on any parts of the body. So what exactly the birthmarks mean? Do they all need to be present at the time of birth? No. Few birthmarks even develop after some period of their growth in their life, probably during the puberty phase. They see the increase in the size of the lesion, an increased hair growth of the patch, or sometimes increase in the darkness of the patches. Usually the birthmarks can be a red type of birthmarks or a black type of birthmarks, or sometimes even white birthmarks are also there. So in this episode we would like to discuss about the black birthmarks. In black birthmarks, even we have multiple subtypes, like where are they present? Are they just present in the upper layer of the skin, in the deeper layers of the skin? Have they associated increased hair growth in the patch, or just a black mark which is very dark, light brown, or a faint patch? So these all decide the line of management, the location where they are present, the rate of growth of these patches, all decide how we should go about with these birthmarks. For example, a patient has a very black patch on the face or anywhere on the body which is more than 2 to 3 centimeters and has associated hair growth. This usually points them towards a melanocytic nevus. So depending upon the size of the lesion, either complete excision or partial excision with stage-wise removal of the lesion is suggested in such cases. In those cases, laser is usually not advisable because they have a lot of pigment in it which doesn't go away very easily, and when the patient has a hair growth, it indicates that they have a deeper dermal component, so just removal doesn't help and they definitely need to be excised and closed to have a better cosmetic result. If patient has a faint lesion which is bluish tinge to black, then we need to think about the dermal lesions like nevus of Ota, where usually we see the patients to be having the black mark, not just on the face or sometimes even extending into the eye area, which involves particularly either the arch of the bony prominence of your face, or sometimes the lower half, or sometimes on the upper half on your forehead in the temple areas. So in those cases, we need to first evaluate the complaints if patient has in any part of their eyes, then go ahead with the laser treatment. Usually, creams do not help with the deeper dermal lesions or any sort of birthmarks. Creams do not help, either it is in the form of a laser, it can be a pigmentary type of laser or an ablative laser, which the clinician will decide which suits you better in your scenario. So if it is a dermal lesion like a nevus of Ota, then they need to go ahead with the laser treatment, which will be in the form of multiple sessions. So the sessions will be spaced around 1 to 2 months gap, giving a result of up to 60 to 70% of the change to happen. So definitely it is the clinician and the consistency of the patients which together go hand in hand to give a better final result. Another lesions on nevus pillars or a cephalic macule or freckles, lentigines, or different type of epidermal lesions. Usually cephalic macules do not have a good prognosis. Nevus pillars, yes, pigmentary lasers do help. Freckles and lentigines, definitely Q-switch laser has to be done in multiple sessions, because sometimes there is a chance of recurrence after removal even with the laser. So it is the type of the lesion, the area of the lesion, the size of the lesion, the growth, all these factors do help us to decide what line of management is good for your type of black birthmarks. Thank you.